Of course. Jeff is absent. Eric Diamond,
Present.
Mike Dixon,
Present.
Rachel Drake,
Present.
okay. Selena is absent. Rue Hatch. Diane Lyon is absent. Tony McMillan,
Present.
okay. Tony Marestro,
Present.
and Don Miller is absent, and Robert Munson is present. So we do have a quorum. And the first item on the agenda, and I'm looking up there because it wasn't with the materials to print, is, if we scroll down, should be the public comment, right? Okay, well, I have to check though, right? So there's no public comment. The next item on the agenda is 2.03, which is the approval of the minutes from the September 29, 2021 meeting of the Group Insurance Committee for possible action. They weren't emailed out to us, so I don't know if,
They were emailed out this morning. The packets were late this morning.
oh, okay. Well, I got the reports, but I didn't see the minutes in there. Okay.
Do you have copies of the minutes? Yeah,
They're
Yeah,
not,
I'll bring them all.
they're not in my packet.
Okay,
they're not.
No.
yeah. Yeah, I just got two reports,
Let me make
which,
sure. Hold
but
on.
I may have missed them.
Yeah, I do see that they
Oh,
were
I
they were
have-
included
I
in
have
an
one-
email this morning at
I
8:44.
have
Okay.
a copy. I can send this.
Okay,
Keep going.
I'll just give people a minute to look.
Copies out there.
Okay.
Well, if they're in the email, I'll pull it up, but it'll just give people a minute to look at them.
Anybody want a physical copy?
Yeah, sure.
Yep.
I'll take a look at it. Because I'm like, can't find the email. Probably in my,
I think we're good for now.
thanks. Okay, when everybody's had an opportunity, if somebody would like to make a motion.
Motion to approve, Tony McMillan. Motion to approve the meeting minutes from September 29th.
Tony Marestio, I second.
Okay, it's been moved and seconded to approve the minutes from the September 29th Insurance Committee meeting. All in favor, please say aye.
Aye.
Opposed, nay? Okay, it's been adopted. Let's go to the next item, which is 2.02, presentation and discussion of the Washoe County District Group Insurance Internal Service Fund as of September 2021 for discussion. Yeah, thanks. It's this one, right?
Yeah. Let me know if you need more.
Okay, well, I printed the two financial ones.
Hello, Jessica
Hello.
Young, for the record, controller. So for the 3 months ending September 30th, 2021, we saw that we actually had a decrease in revenues from the prior year's first quarter. And some of that's explained by lower membership, potentially because we are having turnover and we're having trouble keeping positions filled. And it's also because last year we had more payroll periods for one of the payrolls. We have certain people that get paid 26 times a year, and so sometimes that extra payroll falls within, a quarter that we're comparing. So anyways, that's part of the reason for the lower revenues. As far as on the expenditure side, we saw quite a decrease in the administrative fees for Anthem. And I wasn't able to get an explanation of why they dipped so low, but it might be something we want to look into for an explanation for that. And then we also had quite an increase in the PPO medical claims and the prescription claims. And so basically we're ending up with a change in net position of about $4.7 million for that quarter. So anyways, if there's any questions that I can answer about the financial statements, I do my best.
No questions? Okay, thank you very much, appreciate it. Okay, moving the agenda, we're on 2.04, which is the presentation discussion of Washoe County School District Group Insurance Anthem claims. Oh, wait, did I skip one? 2.03, insurance claims experience report as of September 20. Yeah, so 203, presentation discussion of the Washoe County School District Insurance Claims Experience Report as of September 2021. And that's Lloyd. It's trying to throw me off. I'm like, sorry.
Good afternoon, Lloyd Barnes with LP Insurance for the record. How's everyone doing today?
Good, thank you.
Good. All right, so we'll go through the claims report for September. Everyone's, I think, very familiar with this at this point. So there on Exhibit 1, you can see the current year employee counts, employee and retiree counts actually was down a bit, as noted previously, down about 3% compared to the prior year. So we move down to the claims side of things. Also, as noted, the claims costs are up on an average basis at 5.6 million compared to 4.9 basically last year, up about 14.7%, which yields a composite average cost of $783.47 versus $662.95 last year, so up about 18%. Fixed costs are fairly stable, but as you add them all together, coming in at about $6 million, 6,041 versus 5,317 last year, up 13.6%, with a composite up 17% at 842.21 compared to 719.60. Our large claims are still favorable compared to last year, so still a little early comparatively, but down about 5 compared to last year. If we go to the next exhibit, Exhibit 2, the little graph that we've been referencing here and there, and you can see there visually sort of what's going on. And again, these are rolling 12-month averages, so it smooths the line out a little bit. But you can see the uptick over the last few months quite materially as we have started to see some of those inflationary pressures that we all discussed, and we've sort of been talking about them now for a number of months. As we go to Exhibit 3, again, this is the employee and retiree total plan cost combined. So this is looking just at the month of September, and I'll just sort of draw your attention to the bottom part of the page. You can see there on line 35, the composite cost per employee for the month of September was up at $936.07, which as you compare to the far right there, that's a little bit higher than the average of $842.21, and also quite a bit higher than last year's average of $719.60. So all in all, total costs for the plan are up about 17% from the standpoint of claims and fixed costs. The rest of the exhibits, I'll let you go through at your leisure, the breakout of employee, active and retiree, and PPO and HSA. But let's see, we'll go to Exhibit 12. This is our large claims for the year. So far this year, and again, this is the stop-loss policy runs through the end of December, so still have a couple months to go here, but the list is expanding as it does this time of year. Had a few more claimants hit the list on line 14 and 15, coming in at $316,000 and $219,000 now paid out on those two individuals. We still do just have one individual that has exceeded the $425,000 level, although that number is starting to climb quite a bit now, up to $312,000. We do have a few that are approaching that $425,000 level, so we would expect that a few more will pierce the specific as we get to the end of the year. But all in all, I don't know if I'd call this an average year. I think it's actually slightly below average right now, so still fairly favorable. But you do have a lot of claims that are really reaching that just under that $400,000 level. So I think that is somewhat attributed to the overall increased cost that we're seeing. So with that, happy to answer any questions.
The top part where we have number 11 is at 737,000. So that is gone, that's the one that's gone above the 425?
Correct.
Okay.
Other questions on the claims report for September? Okay, thank you.
Okay. Thank you, Lynn. Okay, so 2.04 now. I'm on track now. Okay, presentation and discussion of the Washoe County School District Insurance Anthem claims activity and turnaround reports as of September 2021. Welcome.
Hi, Pamela Davidson, Anthem Blue Cross Blue Shield for the record. So on this report above, the first report is the claims. So in September, the claims received was 12,882 processed. Out of those 882, or 12,882, 12,735 were processed within the first 14 days. And by the 90th day, 12,882 were processed. So we had 100% that were processed and paid at the same month in September. Out of those particular claims, 11,621 of them were from the PPO plan, and 1,261 were from the HSA plan. On the pharmacy portion, those are processed at point of service. You had 627 claims paid and processed at the point of service for pharmacy. Moving to the dental received claims was 1,949, and within that, all of them were processed within the first 30 days as part of our dental things. They can't go over 30. Does anyone have any questions on the turnaround or the processing of claims?
No questions? Okay. Thank you very much. I appreciate it.
Thanks.
Okay, 2.05, presentation and discussion of the Washoe County School District Group Insurance Wellness Program. Report to cover current events and programs as of September 2021. Is that you, Laura?
That'd be me.
That'd
again.
be you.
Laura Thurston for the record. We are still in our period of wellness screenings, immunizations, and our health insurance premium discount. So wellness screenings are our Saturday events with specialty health ended, but we still have the opportunity to get a wellness screening through November 11th. And that's again through Specialty Health. You can schedule Monday through Friday, 6 a.m. to 10 a.m., or also book an appointment with them to go to any lab core at your convenience as well. Our health assessment, sorry, I jumped around there. Our health assessment is due again on December 1st of this year. Again, that's the online health assessment through Virgin Pulse. Immunizations are still available at any Walmart. Just bring in your insurance vaccination or in your insurance card. The vaccinations offered currently are the flu, the high-dose flu, Tdap, pneumonia, and shingles. And we just started a new challenge, a fall step-a-thon. The challenge started on October 18th and runs through November 8th. The top 10 teams and top 10 individuals earn Virgin Pulse account points. There'll be 10 raffle prizes of 50 Amazon gift cards for those who average 7,000 steps a day. Currently, we're looking at about 131 teams that are participating and 536 individual players. And then our next challenge coming up is a financial challenge, financial wellness challenge. It's called On Budget, and that begins on November 8th, and it's a week-long challenge. And we'll be receiving notifications through email on that as well. Questions? Yes.
I've had quite a few people ask me about booster shots, if the district's going to do something about that, or if they should be going out and going to like Walgreens or somewhere and getting their booster shots.
You know, there hasn't been any conversation in the wellness department with that right now. So I have no good answer at all. The previous COVID vaccinations were done through the district, and I don't remember what the committee was, but there was an actual committee for those. So it's possible that that will be offered, but I couldn't tell you. I would say if we ever expect to see those go through wellness, it will be when and if it becomes more of a regular occurrence, like a flu vaccine, that type of a thing.
Okay. Any other questions?
Any other questions?
Oh,
Tony?
Tony Marestio, is there, they're having an immunization clinic at Bond tomorrow, and I'd like to get my booster. Is there any charge?
I don't know if that is not a district, well, sorry, it could be a district immunization clinic, but it's not through our employee wellness program, so I'm not exactly sure on that.
Okay.
Sorry about that.
Tony, I believe those are the health department, and they're just using our sites.
Okay, thank you.
I believe that's what that is.
This is Rachel Drake for the record. It is my understanding that there's no cost to staff during any of those events that are being run by the health department for either initial shots or boosters.
Okay,
That's all
thank you.
Thank you. Okay, closing items. It's been a long day. Yeah, I need an island drink. Okay, public comment. Any public comment? Okay, seeing none. The next meeting will be November 17th, 2021. I'm assuming it'll be here in the boardroom at 4 p.m. Okay, if there are no other questions or things, we'll just go ahead and adjourn. 3:03. Meeting adjourned.